listening to Practice on Purpose, where physicians can explore how to set up their career on purpose from the beginning to stay connected to their purpose for their entire career. I'm Dr. Nicole Eull, a health psychologist with decades of experience in healthcare, from the front lines of a level 1 trauma center to the leadership in one of the largest healthcare systems in the country. I'm passionate about physician well-being and creating mentally healthy workplaces. If you want to thoughtfully establish a career that aligns with your values and passions and ensure a long and rewarding life as a physician, then you've come to the right place. Today, we're talking about women in medicine and gender equity in the medical field. Dr. Shikha Jain is a leader dedicated to transforming healthcare. As a triple board certified hematology and oncology physician, she is a tenured associate professor of medicine at the University of Illinois in Chicago. She also serves as the Director of Communication Strategies in Medicine and the Associate Director of Oncology, Communication, and Digital Innovation at the University of Illinois Cancer Center. Dr. Jain is the founder of the nonprofit Women in Medicine and the Women in Medicine Summit, a nationally recognized platform that unites healthcare professionals to address challenges and develop solutions. Her work provides mentorship, leadership training, and opportunities for career advancement, helping individuals reach their professional goals. My goodness, that's so much. So welcome, Dr. Jain.
Thanks for having me. I'm excited to be here.
I'd love for you to start off, just tell in your own words, tell us a little bit about yourself, about your specialty, and what you're currently doing.
So I am a triple board certified internal medicine, hematology, and oncology physician, but my area of expertise is GI oncology. So I clinically see patients who have cancers of the GI tract, and that's where a lot of my clinical research is focused as well at the University of Illinois Cancer Center. So that's my main job, my first hat that I wear. Then I, over the last 5 to 10 years, have become a national media contributor, fighting misinformation, talking about public health education, and have been able to do that through writing op-eds, through going on national networks and talking on TV, the radio, all of those fun things, really to try to get education to the people in whatever way that they access it, because we know some people use social media, some use TV, right, some use newspapers. So that's my second hat. And then my third hat is what you mentioned, that I founded and I'm now chairperson of the board of the 501c3 nonprofit Women in Medicine. That all began back in 2018 when I started the Women in Medicine Summit. So I have multiple hats. And then on top of that, I have 3 little kids who are currently age 10, 7, and 7. And I'm married to another physician who is a GI physician.
And yet you look so relaxed.
It's all makeup.
I hear you. So let's start at the very beginning. So you are you have a specialty in oncology and GI oncology. Could you share with us a little bit about what attracted you to that specialty and what you did for your first few years after graduation? How did it all start?
I actually thought I was going to be a surgeon because my father is a surgeon. I wanted to be a vascular surgeon. Then I thought I'd be a pediatrician. Then I thought I'd be a cardiologist. So I went through a bunch of different fields. When I was in medical school, I realized I really like adult medicine. And so that's why I decided to become an internist first. I did internal medicine residency. During residency, I really loved cardiology and pulmonary critical care and oncology, 3 very different specialties.
Yeah.
And the oncology space really drew me in because I loved the fact that you could also not only deal with acute issues and acute challenges, but also really the long-term relationships that I developed with the patients in that space, the trust and the intimacy of that doctor-patient relationship, getting to know the patients' families and really having a connection and having a long-term relationship with many patients was really what ended up drawing me to oncology. Plus the science was just fascinating.
Yeah.
After internal medicine residency, my husband and I did something a little different where we got married. We did long distance during residency, got married right after residency, and moved to New Zealand for a year, where we did locum tenens work as internists before we came back to start our fellowships. Started my hematology oncology fellowship, did that for 3 years. And then I went to Northwestern, where I was an academic general hematology oncology physician for a few years. From there, I was recruited to Rush University, where I spent a little bit of time, and then got recruited back to the University of Illinois, where I had done my residency training. So kind of full circle moment.
So we've actually interviewed a former resident of mine last season in this podcast who is went to New Zealand for 2 years and never came back. So she's still.
I will tell you, my husband is pushing for us to go back. He's like, even if it's just for 6 months, like, let's just go, let's just do it. So it was a transformative experience. We managed a small hospital in this small beach town. It was just an incredible experience. Highly recommend if you ever get the chance to do locums out there to do it, because the people are amazing. The country is amazing. The food is phenomenal. It was a great experience.
She's greatly enjoying the culture. So if anyone wants to know more about that, you can go to our season 1 episode on studying and living abroad and working abroad. So you are now in academics and you've worked many years in academics. And how did you start teaching? And also, how would you describe your teaching style?
I've always loved teaching, even when I was in medical school. For some reason, I just enjoy educating. I think a part of it comes from when I was little. My dad used to teach me and my brother all sorts of things about surgery and vascular surgery. We'd watch these videos at home, and he was really good at taking very complicated topics and explaining them in a simple way so we could understand as kids. And so I learned that from him growing up, and I really have enjoyed kind of doing that type of teaching with not only students, residents, and fellows, but also with the public and the community. In academics, teaching is kind of part and parcel to what you do. It's a part of your everyday. So whether it's teaching at the bedside, teaching residents when you're on rounds, or whether it's giving didactic lectures to medical students, I really enjoy all of that. I didn't actually realize that some of this work that I'm doing, for example, through Women in Medicine, was also considered education, whether it's going on TV and talking about things, or whether it's, writing an op-ed. There's lots of different ways to educate. So when you ask what my teaching style is, I think it depends on the modality I'm using to teach. So at the bedside, I really enjoy teaching things on a case-by-case basis, where we talk about specific challenges with patients that we're seeing, or specific diagnoses or manifestations. So really bringing it back to the person and talking about the individual nature of each case and each diagnosis and pathophysiology. When it comes to bigger topics, it's more talking about generalities, and again, making things simple enough for people to understand them, but complex enough to be at the level of whoever I'm teaching it to.
I think with oncology, especially when you're working with your patients, there's so many unknowns, and it's not an area that many people know much about, or they've just heard how their friend did something, or they saw something on the internet. I think that education from the physician is so vital.
Yeah, absolutely.
So you were named the 2024 Illinois Physician Leader of the Year, right for you, and one of Medscape's 25 Rising Stars in Medicine in 2020, and a Modern Healthcare Top 25 Emerging Leader in 2019. So you're definitely getting some media attention. And so you're obviously a leader yourself, but if you look at all of your materials, it shows that you definitely have this ongoing commitment to support and advance the careers of other healthcare professionals. So where does that passion come from, and how are you accomplishing that goal?
Well, I was very fortunate growing up with, my father, as I already mentioned, and having some amazing mentors and sponsors without whom I would not be where I am today. And a lot of people don't have those opportunities. They don't have the privilege of having those people in their home or in their networks or in their communities. So for me, it's really about giving back, because I was given these opportunities, and I want to make sure that I provide those opportunities to others. And not only that, I want to empower other people to empower others, because many of us don't realize the impact we can have with just simple, small interventions. For example, if I'm ever invited to give a talk and I can't, it's very easy for me to suggest somebody else. And that is an easy way of sponsorship. And I never thought of it that way before. I just thought, I'm suggesting this other very qualified person. But in actuality, those are really small things we can do that can have a big impact on people's careers. So for me, it's not only about doing it myself, but also educating others on how they can have an impact. Even from the time you're in college, medical school, there are ways that you can help and lift up others, even if you don't realize that's what you're doing. So that's where that drive comes for me, where I don't think I realized the impact until recently that all of these people have had in my life. And I want to make sure others get that opportunity as well.
And in this podcast, we talk a lot about staying connected to your purpose. And I personally think I do the same thing as a speaker. I try to pass on any opportunities that I can, lift up other people. I think that really helps you to stay connected to your own why, giving to other people. And I found throughout much of my research and reading about other successful people that one of the things they do is set aside time to connect other people for no reason, not for any personal benefit, but because they truly believe that those people should be connected or lift up. And I think that's so important.
Yeah, I think part of the reason that I keep doing this work, and people ask me all the time, how do you not burn out? Why are you not exhausted? And for me, it's because at the end of the day, it's really about the mission. What am I trying to accomplish? A lot of the stuff that I do, I don't do it for personal gain. I tell patients all the time, the more time I spend with you, I actually lose money, because patients often have these preconceived notions that you're talking about vaccines, you're actually getting a cut of the money.
Yeah.
And so I think we sometimes forget that there are people out there who want to do good for the sake of doing good. There are people out there who want to help others just because they feel like they want to do that. And that's how I was raised. I was always raised to believe in helping others and believing in the good of others. And so that's what I've tried to pass down to my kids. It's what I try to pass down to my trainees and to my mentees. And I think it's important because we are stronger together, and lifting up others doesn't take away anything from me. It actually can help me as well, unintentionally, with the ripple effect of the impact it's having on the system.
And this is such valuable and important information. I really hope listeners are tuning in right now to what you're saying, because I do think that connectedness, that purpose, that generosity to others is a resilience skill. And it really helps people to reduce burnout and to feel like sometimes that the same level of stressful environment is maybe a little less stressful.
Absolutely. And I'll tell you, there are days, I don't want to sound Pollyanna. There are days where I'm exhausted, or I don't want to do this anymore. And then my husband is like, why are you still doing this? You're up at 11 o'clock sending emails. Like, what are you doing? And there are days where I feel exhausted and I feel burnt out, but somehow the fate or the stars align, and I'll get an email or a message that day from someone saying, thank you so much for this opportunity, or you're introducing me to this led to this ripple effect where now I've gotten this other opportunity. So somehow, something will happen that will remind me of my why and help me to keep going.
I think this is so important for women, especially, that we're really natural at this and we're good at it. And there's a vast, infinite amount of fabulousness in the world. And there's just enough for all of us. So lifting other people up is only a positive skill to engage in. So thank you for sharing that. So you're involved in one of the things I like to focus on as well is helping young professionals understand the value of their professional organizations. With the internet available, social media, I think there's a lot of people who think that professional organizations aren't valuable or they're not really serving their specific needs. But you're involved with the American Society for Clinical Oncology. You've been involved, I believe, in chairing the Women's Network Center Task Force and the Diversity Inclusion Task Force. And you're also involved in the Illinois State Medical Society Council. And I think your special focus there is communications and membership advocacy. So you've also contributed to other national task forces. And you're so involved in these professional organizations. What are your favorite things about these organizations, and what are you committed to addressing?
I think that it's really important for people to lean into the organization that speaks to them and that can help them professionally or personally. So let's break it down to a couple of the ones that you mentioned. So ASCO, or the American Society for Clinical Oncology, is focused on oncology, cancer care. And for me, it has been a wonderful organization to be a part of. One, just for the resources as an oncologist, the education component. Oncology is changing. It feels like on an hourly basis with all the new things that we are discovering. And so having a network within our national society where I can find trusted information, where I've found colleagues who have now become friends, and people who I can reach out to if I'm dealing with a difficult case, if I'm having a situation where I've got a young pregnant patient who needs chemotherapy, and what have you done in these situations? I think that having the support of your society can be really beneficial, not only for the educational component, but also for just the collegiality and connecting with other people who may be facing similar struggles to you, not only from a professional standpoint, but also from a personal standpoint. We have created groups within the ASCO organization. You mentioned the Women's Networking Task Force and Center. So we have women who come together who talk about, how do you manage your kids' activities when you've got to go to a national conference, or who's doing the dinner when you have to give a talk at night. And I think finding those people who have been able to help me navigate parenthood as a oncologist is also really helpful, because I'm in a dual physician family, a dual physician household.
Right.
My husband does a lot, but we both have responsibilities. So how do you outsource what needs to be outsourced without feeling guilty about it? So I think really leaning into those professional societies to get out of it what you need. There's a lot of different things you can get out of it. ASCO does a lot in the advocacy space as well, which has been great to see. And I've been able to engage there. So and you can also be a part of talking about guidelines. I just got asked to be a part of an AI guidelines task force where we're talking about how AI can impact oncology. So
sure.
It's a really cool way to not only get a benefit for yourself, but also potentially contribute to future advances. The Illinois State Medical Society is a great state society. They do a lot in our state when it comes to advocacy efforts, when it comes to figuring out what Illinois physicians need. During the COVID pandemic, they were integral in working with us and getting infographics out and getting information out to the public, getting vaccine information out. So I think depending on the society, you can find what best suits your purposes, and also how you can contribute to have an impact on that society and potentially on your field.
Okay, so you have a lot going on with that as well, but there's one thing that I think is one of your true passion projects here, is that you are the founder of the not-for-profit Women in Medicine and the Women in Medicine Summit. So this is a massive undertaking. I am a speaker myself, so just imagining what it takes to put on this kind of event is really impressive. So you want to tell me more about that work?
Yeah, so I started this summit. This is going to be our 7th summit this year. I started it back when I realized that a lot of challenges women in medicine and women in healthcare were facing were very similar across specialties, across fields. And I, despite having amazing support systems and having amazing mentors and sponsors, had situations where I was treated poorly, I was bullied, there was sexism, there was racism, and I had internalized all of that and thought that I was the problem. And so when I started talking to others and felt comfortable speaking to others about it, I realized I was not the problem. The problem was the system.
Right.
So I launched the first Women in Medicine Summit in 2019. We had over 450 people there, and it was about to become a national phenomenon, international phenomenon, and then COVID hit.
Right.
So when COVID started, we decided to move the conference virtual, and I had people reaching out to me saying, we need more. What can you do? How can we connect? We need something. And so I launched through sheer will at that point, we launched these Women in Medicine Speakers Bureau to make sure we were getting women's voices out there. We launched a research lab. We launched longitudinal leadership programming. We launched allyship programming to help men become more inclusive leaders. And my father said to me a year in, hey, honey, you've created all of this stuff. This doesn't all live under the summit anymore. What's the plan? You need an umbrella organization. So that's how the Women in Medicine nonprofit started. We became an official 501c3 in 2021. And since then, we have just continued to grow and expand. We've collaborated with national organizations like ELAM and the American College of Physicians. We've collaborated with Sheryl Sandberg's organization, Lean In. This year, we're collaborating with an organization called Feminem and launching a women's health pre-conference to our annual summit, because there's a lot happening in the reproductive health and women's health space. So we want to provide a forum for women in healthcare to talk about that and educate. So our summit has expanded and grown. Our nonprofit has expanded and grown. And it has been just a whirlwind to see all of the impact we've had over the last 7 years. And I can't wait to see what we're able to do moving forward as we continue to grow and collaborate.
That's such an amazing story. And Isn't it funny that even when we're grown women, our dads still guide us sometimes?
They do. Well, it was so funny because I will never forget this conversation. He said, "You are doing so many amazing things." He goes, "But this is much more than a conference. Have you thought about it?" And I said, "I haven't had time to think about it. I'm
Yeah.
just doing." And he said, "Well, you need to sit down and think about what you're going to do next, because you've got to find a place for all of this stuff to live." And so, sometimes your dad, I'm lucky. My dad is my biggest ally, mentor, sponsor, confidant, friend. I mean, he's really helped him and my mom together. Without them, I would not be where I am today.
And if I'm doing the math correctly, you were launching this with 2 kids in diapers. So
I was.
very impressive.
I don't know if it's impressive or if it's just, I was not thinking clearly because I was in the new mom with twins phase. Yeah, my kids have grown up with the summit. They love it because one of the ways as a parent, I've tried really hard to make sure my children and my family always knew they were a priority and they were first. So my daughter actually now is 10. When she was 8, she wrote the epilogue in our Women in Medicine Evolution of Empowerment book that we published. She also walked in our Women in Medicine fashion show that happened. All 3 of them have volunteered at our gala. They've given out raffle tickets. They've been models for us. So they all feel as much a part of the organization as I do. And they're very proud of it. I told them one day, I said, "What would happen if mommy stopped working on Women in Medicine?" And they said, "But you can't. What are we going to do?" And so they feel as much pride over the organization, I think, as I do. And for me, that's really important because I never want my family to feel like they are second when it comes to my career or any of the other passion projects that I'm working on.
Yeah, I think that's so important. I think kids learn so much from being involved in business. And I teach improv workshops for communication skills. And my daughter got really interested in improv, and she's now the master. She's taken 4 years in an improv troupe here locally. And so now we're launching a foundation to teach improv in inner city schools, the 2 of us together. And she's 15. So I feel like these are such great opportunities as women, as business people, to expose our kids to such opportunities. I think we underestimate our kids and what they're capable of.
Yeah, absolutely agree.
So you have a lot going on, clearly. So how do you set boundaries at work and take care of yourself?
So I've gotten better. I have been bad at it in the past. I will tell you, during the pandemic, the first 2 years of the pandemic, I was very bad at setting boundaries. And it was actually a conversation with my husband where we sat down and I said, okay, because he said, you're not sleeping, your health is taking a hit, you're not exercising, you are 24/7, either family or work. He was like, that's not sustainable. And so it took somebody external telling me, because I would have kept on going and I would have burned myself out. So I appreciate, like I said, I'm lucky to have a good support system in place. What I do now is I try to think very hard when an opportunity presents itself. Is this something that will bring me joy? Is it something I have to do for my job? Is it something that will help my organization or help the mission of any of the current initiatives I'm working on? Is it something that will help someone else? Is it something I'd be willing to say no to something else for? Because every time you say yes to one thing, you have to say no to something else. So I try to go through that kind of checklist in my head before I say yes to opportunities. And I've started saying no to more things these days because I have to really think about my kids are getting older. They need me more now than they did when they were babies. When they were babies, I needed to change their diapers and feed them. Now my daughter wants to talk about, emotional things that are happening at school. My boys want to talk about basketball. They want to talk about their activities. And so I want to make sure that I'm not saying no to my kids for an opportunity that really wasn't filling a bucket that I needed it to fill.
This is so important. There's a quote I use in a lot of my trainings, and Paulo Coelho said almost exactly what you're saying. Be careful when you say yes to others that you're not saying no to yourself. And I think that's interesting version. But as a mom and a wife and a friend and a daughter, I say, every yes has a no, just like you said, because sometimes I say, if I'm saying yes to something, I'll be saying no to time with my kids or time at home or time with friends. And so I have to decide if that no is okay with me, right? Same thing. So I think this is an important concept because a lot of us as women want to say yes to things and please people or serve or give. And it's so important what you're saying, this idea that every time you say yes, you're going to say no to something else. So there's always a no. Exactly. It's just maybe not the one that's most direct or most obvious. So this is great.
My mom actually said something to me a couple of years ago that sticks in my head, where she said, the more you succeed at things, the more people are going to ask from you, and people are going to keep asking and asking and asking, and they don't know what is happening in the rest of your life. So they just know that you are doing well. So if they keep asking and asking and asking of you, and you keep saying yes, they don't know what part of the rest of your life that is impacting. Only you know that. And so something that I say to people all the time, to my mentees all the time, is you have to be the CEO of your own life. You have to control your life, because you know all of the balls that are in the air, you know all of the moving pieces, and that Jenga board is going to fall if the wrong piece is pulled. And so you need to be cognizant of the fact that people will keep asking you for things, and they will keep taking from you, not because they're mean, but because you're doing a good job.
Because you're good at it. You get it done, right? Yeah.
So that's why you got to make sure you're thinking about your life and all of the moving pieces before you say yes.
So what is your best or favorite thing about your work?
Oh, I love, like, when thinking about all of the things that I do, I absolutely love teaching. And I love when I hear from people, you said something that made sense. I didn't understand this before, and you crystallized it for me, whether it's a medical topic or whether it's a leadership topic. Just being able to impart knowledge and help people wrap their minds around something a little bit better. For me, that gives me such joy. And also when someone reaches out and says, your sponsorship of me allowed me to do this, or your teaching or your suggestion led to this opportunity for me, that gives me a great deal of joy as well.
That's so great. So what are some of the challenges you face?
I love too many things, and I love doing too many things, and I have a hard time saying no. And I mean, even with patient care, I was just talking to my nurse where a patient needs to be seen. I'm already triple overbooked, and I can't say no because the patient needs to be seen. So that is it's a real challenge for me, because I've always been a people pleaser. I've always been someone who just likes to say yes. And I like to be known as the reliable person who you can always count on. And so that is something that I really struggle with. My boss actually the other day was talking to me about something, and he said, yeah, we need someone to do this. And he paused and he said, before you say you can do it, I know how many plates you are juggling. You cannot do it. Do not offer. So people know that about me. They know that I will step in, and I have to really work hard on setting those boundaries.
Yeah. I think this is hard in fields where you really do have an impact on people, because, it's easy for people to say, are you going to, on your deathbed, be wishing you'd gone through that next spreadsheet? Okay. Yeah, probably not. But on your deathbed, will you be proud that you saved lives, or that you made time for someone to hold their hand when they're dying? Maybe. And so the work you do is truly life or death. And so it is important work, and it does sometimes have to be double booked, right?
It does. And I could tell you so many patient stories where I became very close with the families. They, even now after the patient has passed away, reach out and say, we think about you fondly. You changed our lives. You are the reason my mother or my father's last few years were as peaceful as they were, and they were able to live their life to their fullest. And that to me is worth its weight in gold.
Yeah. Do you have your own mentors? You talk so much about being a mentor and being a teacher. Who are your mentors?
So I've talked a lot about my dad. So he's definitely one of my biggest mentors. I have a mentor from when I was in medical school. His name is Dr. Mark Lurkey, and he has been my mentor since year 3 of medical school, but he's actually known me since I was a little kid. And he is still someone I call when I'm facing something really tough. Dr. Vinny Aurora, she is currently the Dean of Medical Education at Pritzker. She has been a mentor, a sponsor, and a very good friend. She is the best person for me to call when I say, okay, you are doing too much. How can we offload these things from you? And also has helped me sponsor other people, and she sponsored me numerous times. So those are a couple of my most champion mentors. Dr. BK Gotti, another one. He is my boss currently. He's the deputy director of our cancer center, and he has been a mentor and a sponsor to me as well. So I've been fortunate to find mentors throughout my career, as I said, and some have been with me for years and years, and some are newer, but I rely on them quite a bit.
How do you differentiate between a mentor and a sponsor?
So I actually wrote a paper on how you can be a mentor and a sponsor because people often separate them into two buckets because mentors and sponsors do different things. So a mentor is someone who kind of gives you guidance and advice and helps you navigate things and helps you become successful by helping you when you get the opportunity. How are you going to succeed at the opportunity? A sponsor is someone who says your name when you're not in the room. A sponsor is someone who suggests you for an opportunity. So Dr. Julie Silver is somebody who I actually focused this paper that we published about talking about mentorship and sponsorship, where she once sponsored me for an opportunity to give a talk and then mentored me afterwards to make sure my talk was appropriate for the audience. She looked at my slides. So I think you can be a sponsor and a mentor, although those roles are very different. My dad is my first ever mentor sponsor, where he sponsored me for an opportunity and then went through my slides with me. So I think there is a difference, but you can be both.
Okay, great. So I have a few closing questions I like to ask everybody. What is one piece of advice you would give to an early career physician?
Oh, that's hard. I would say there's going to be bumps along the way, and there's going to be days where you feel like you're struggling. There's going to be days where you feel like you don't know why you're doing what you're doing. No, we've all gone through that. We've all felt like imposters. We've all felt like that feeling of, oh, what am I doing here? I would say lean into your networks, lean into your mentors, your sponsors, and your friends. Friends can really be the people who help you get through those dark times. So just know there is light at the end of the tunnel. If you're going through one of those times, please reach out to someone that you trust and talk to them, because we need you in medicine more than ever now.
Right, for sure. What advice would you give to your own younger self?
Probably the same advice.
Maybe say no more often.
Say no more often. Trust the people around you and lean in more to your networks and to your circles, and ask for help when you need it. I don't think I asked for help enough because I was trying to prove that I could do everything. And I think asking for help is something we often don't do enough. And give yourself grace. Cut yourself some slack.
Brene Brown says that the vulnerability is the greatest form of bravery. I think that's so, just ask for help.
I agree. And in medicine, we are taught the opposite. We are taught not to be vulnerable. We're taught not to cry in front of patients. We're taught not to show that we are weak. But my patients go through struggles with me. When my kids are sick, my patients know. When I'm going to a soccer tournament over the weekend, my patients know. I think that sharing the human side of who we are as people also helps build those connections with patients, so they don't just think of us as a doctor. They also realize we are humans too.
Yes, I totally agree. What are you loving now about medicine? What are you excited about in medicine?
Well, oncology in general has so many amazing, groundbreaking things that are happening with immunotherapy, with vaccine therapy. There's some incredible breakthroughs happening in the cancer world, which really excites me. And the other thing that really, really excites me is I am seeing a influx, a flood, a wave of advocacy from all generations in the healthcare space. I feel like before, advocacy was kind of to the older generation, and the younger generation in the middle was just focused on trying to get through the day. And I'm starting to see the advocacy from early career medical students all the way up to retired physicians and healthcare workers. So I'm really excited to see that advocacy has become a central part of what many physicians feel as a part of their job and feel as a part of their responsibility. And I think it's going to transform our healthcare systems in the next decade.
Okay. So what's next for you?
Oh, well, I got 3 kids, so I got to see what activities they have this weekend. But I think for me, women in medicine is really growing very quickly, very rapidly. And I'm really excited to see where that goes. Our summit is coming up. So mark on your calendar, September 18th to 20th in Chicago. Registration will be opening in March. So really excited about our 7th summit. We are just growing, and it's just an exciting time. And then from my professional development in my career, we're working on expanding our cancer center to become the statewide, well-recognized, nationally known cancer center. So hoping to do some advocacy work and some outreach work in that space as well in the next year or so.
So just a few things.
Just a couple things.
Just a few things. So thank you so much for being with us today. I think this was a great episode, and I think people will really benefit from hearing your candidness and your take on giving back and mentorship and sponsorship. And hopefully, we'll enact some of that. Even if they are early in their career, there's always ways to mentor other people. So, is there any place where people could learn more about you and the Women's Summit and the Women's Foundation?
Absolutely. So you can find me on most social media platforms at Shikha Jain MD or my website, www.shikhajainmd.com. You can also find all the information you want about women in medicine at our website, www.wimedicine.org.
Mm-hmm. Okay. So thanks so much for joining us for this talk about women and balance and mentoring and sponsorship. We hope this show has you thinking about your own career and what action you can take to make it ideal for you right from the start. If you've enjoyed this episode, please like and subscribe and tell others to join us. We greatly appreciate your reviews and comments, which help us grow to a wider audience. Let me know what topics you want us to explore in future episodes. And remember, build your practice on purpose to stay connected to your purpose. I appreciate you joining us on this journey, and let's keep exploring together. Until next episode.